The majority of people with breathing problems also have problems with mucus from time to time. But did you know that mucus, the color, the consistency of it, can actually be kind of a pathway into your overall health? Well, I'm going to go over how you can look at your mucus and tell what's going on inside your body. So, the big thing is if you don't already look at your mucus when you cough it up, you want to start doing that. That way, you know if it changes any, okay? Also, the color of it and the way it looks can tell you a little bit about what's going on. So, I'm just going to go down the list here with the colors. Clear is, as you would probably guess, normal. Usually, if it's clear, it's thinned out quite a bit. So, typically, if you're coughing up clear mucus, it just means that it's normal mucus, nothing going on, and that you're hydrated. If it's white, this is also normal. Lots of people cough up white mucus, especially people who have COPD. Now, it can be a sign that you have a lot of mucus, or that you're a little bit congested or you've been exposed to some sort of allergen. But again, the white is normal. Yellow. This can be a sign of an infection. So it's either a sign that an infection is starting or you already have one. So anytime your mucus is a different color than white or clear, you want to contact your doctor. Now, green mucus, this can be signs of either a different kind of infection or a more serious infection. So you definitely want to call your doctor if you notice that your mucus is green. Brown or rust color. So this could be several different things. It could mean a really bad infection. It can mean that you have dry blood in there. Or it could also mean that the mucus that's in there and that you're now coughing up has been in there a long time. So, a lot of times people will see this almost as they're getting better, but it's because they've coughed out all the yucky mucus and they're finally getting to the mucus that's been in there the longest and they're able to cough that out. Red, especially if this is fresh blood looking, is in fact fresh blood. So you definitely want to keep track of that. This can be normal if you notice that you're just coughing a whole lot. You can irritate the airways, and sometimes that can cause fresh blood. But it's always something that you want to notify your doctor about. Okay, it's never normal, so always call the doctor. If it's pink and frothy, this could be a sign of fluid in your lungs rather than mucus. And now this froth, it can actually be clear. So clear to a light pink froth is normally a sign of fluid. So if you're coughing this up, once again, you want to call your doctor. Just make sure everything looks good. You don't want fluid in your lungs. That's going to make it really difficult for you to breathe. So you always want to look at that. Now, I also said something about the consistency. So, if your mucus is really thick and sticky, then that could be a sign of dehydration. If you're getting some mucus like that, you want to drink lots of fluid. And I also have something else for that I'll show you here right now. This is called Breathe. It's awesome. This actually has something in it that will help thin your mucus out, and it has something in it that will help you cough your mucus out. So both of those things are super important when you have that thick, sticky mucus. I'm going to show you how to take this real quick because it's really easy. You take it every morning, and you keep it in the refrigerator first of all, but you want to take a dropper like this and you just put it right in your mouth. It tastes good. Just do that once a day. That's going to help with the thick mucus. If your mucus is thinned out, then that is a really good sign that your body is hydrated and you're going to be able to cough up anything that's in there. So now that you know all about mucus, I want you to start looking at it, tracking it, so you can tell your healthcare provider if you start noticing any changes in the mucus.